Hi guys, I'm Dr. Tara Tobias. I just want to welcome you all back. I am super excited with all the comments I got on the last video to share this next installment. So if you're just joining us, we're going through a progression of activities for those of you that have spasticity or high tone in your ankle and your foot has a tendency to point and invert or turn inward, to progress your standing and walking and hopefully improve your overall balance and your overall quality of movement when you are stepping. So just to review, in the last video, I said it was pretty much passive. We were working in a flexor pattern. Please go back and watch that video. I think it's actually over here. When you get a chance, definitely it's going to help to make this video make more sense if you go back and watch that video first. But basically what we went over was your body is going into an extensor pattern, and we are trying to break up that extensor pattern and get good quality movement at each joint so that you're not either all or none or either extending or flexing, but actually isolating each joint. So the first step was basically just stretching into a flexor pattern because the extensor pattern is dominant right now. I wanted to reverse things a little and have you go into a flexor pattern that'll help to stretch the joints so that they have the range of motion to be able to do some of the movements that we're going to be doing. But also, as you all know, that is what is making your leg stiff and feel like it gets stuck to the ground when you're walking and trying to swing that leg through, is that it's stuck in that extensor pattern. So we went into a flexor pattern more or less in the last video. And the ultimate goal is that you're not in either pattern, that all the joints don't have to either extend or flex, but that each joint can work independent of each other. For instance, we would like the ankle to dorsiflex, and as I said in the last video, that usually occurs in the flexor pattern where the knee and the hip also flexes. But for walking, to stand on that leg, you have to be able to extend the hip and dorsiflex the ankle. When you go to sit to stand, same thing. You're extending the knee, but you need to dorsiflex the ankle because you need to be able to bring your body weight forward. So ultimately, we are progressing all of these activities so that your body does not work in either pattern, but that each joint can work independently of the other joints. So today what we're going to do is we are going to start that process of breaking up those patterns. So flexor pattern and extensor pattern, just breaking up those patterns and isolating each joint. Just like the last video, I love to start out with more static positions and then progress to more dynamic positions. The first thing that you're gonna do is you are gonna start in what I call a crouched position or a mini squat position, and you're just gonna slowly load the leg. Just like I talked about in the last video, you wanna introduce weight to the leg slow so that it doesn't feel like it needs to freak out and go into a full-blown extensor pattern. You're going to start with both feet even. I like the stool because I think that it helps you to pay more attention to your involved side. So we're assuming the stool is on your involved side. Again, you'll see I use the wedge in some clips and I don't use the wedge. Just the wedge is just to remind you all that if your foot severely inverts and you get a lot of pain on the outside of your foot, that the wedge will help to bring the weight more to the inside and hopefully stop some of that inversion that you're getting in your foot, or what we call supination. So again, you're going to start with your feet even in that mini squat or crouched position. The reason you stay in this crouched position is we are trying to introduce weight to the leg without going into an extensor pattern. So if you stood all the way up and did this, you're most likely going to go into that extensor pattern. So we're trying to stay far, far, far. I call it like the edge of the cliff. If you work really close to the edge of the cliff, you're more likely to fall off. But if we just flex everything a little bit more than is natural, you're going to be more successful at keeping that knee flexed and it not locking out on you. The second you start to get close to that full extension, you're really close to the edge of that cliff, and most likely that leg is just gonna go into an extensor pattern again. So we're gonna start in this little crouched position. We've got a little bit of dorsiflexion in the ankle, and then we're slowly just gonna load the leg. Just like we did before, you introduce weight to the leg slow. When you can stay in this flexed position when loading the leg and it doesn't go into hyperextension or even close to extension, you can start to do a little heel lift on the other foot. What this does, it just puts a little bit more emphasis and a little bit more weight on that left leg. And you're basically just testing that leg and just feeling it out. Can it stay in this position? Does the foot supinate when you lift that heel? If it does, go back to just standing and just weight shifting. Now again, don't rush things. I did see some comments, and I am gonna call some of you out. I did see some comments that you were super excited for the next video, but that was just 2 days ago. You could literally spend days on that last video, and the longer you spend on it, the easier it's gonna be to progress through all of these more challenging activities. So same with this one. If you just need to go back to weight shifting or even standing on 2 legs, just trying to get to the middle, because I'm sure a lot of you shift way over to your uninvolved leg. If you just need to sit on this exercise and just work on just getting your body centered over your feet, there is no harm in that. It's actually, you are doing the smartest thing for yourself by just sticking with it and not feeling like you need to go on. If you can shift that weight over and you do a little heel lift and the leg is not buckling and you're not going into a hyperextension and the foot's not rolling to the outside when you do that little heel lift, then go ahead and try and take a little step, little tiny baby step. Now you'll notice my hip is extremely flexed. You want to be bent over on this. When you start to stand up and extend those hips, there's a really good chance your knee is gonna extend and your foot's gonna plantar flex or point. So that is why I'm extremely flexed. I'm gonna do a little forward step and a little backward step. And again, you could stay here for days. There is no shame in that. If you want to think long term and what you want your walking to look like a year from now, and if you want it to be less painful and more what I call normalized movement, then stay here. Because as soon as you go to standing up, and that knee extends and that foot plantar flexes, it's just always gonna make walking difficult. You're always gonna have to hike your hip up to get that foot through. You're most likely always gonna need something to lean on in your uninvolved hand. So there is no shame in just staying on this activity. So once you feel like you can do that and you can take that forward backward step and your knee is not hyperextending or buckling on you, then I call this, we kind of work things in reverse. So instead of doing a sit to stand, you're gonna start in this high position and go down almost into a partial sit and then come back up. The whole goal of this one is so that you can stay somewhat forward, because that means that your ankle is staying dorsiflexed while we're starting to do more dynamic movement at the knee. When you feel like you've mastered that, the way to advance it is to step one foot slightly forward. That puts a little bit more emphasis or bias onto your involved leg, and do the same thing. These little mini squats at in the middle of the range. So we're not all the way extended, we're not sitting down, because the 2 endpoints are gonna be the most challenging. So those are what we do more towards the end, but you get in that middle range, and that's when your muscles work the most efficiently. So it's a great place to practice isolating movement at each joint. Now you will notice I'm overemphasizing that forward movement. So that forward movement means that you're not extending the knee prematurely, which I see a lot. People push their knees back a little bit early. So you're not doing that. And then from here, what you do is, as you work this in reverse, when you get to a point where you can get pretty close to the mat and control it down and control it back up, Then go ahead and have a seat, and now we will work a sit to stand. So you'll work from sitting to standing, same positions. Again, if when you go to stand up, you feel like you need to pull yourself forward or your body goes backwards, that means our plantar flexing. So go back to the standing position and just really work on extending that knee while keeping your ankle dorsiflexed. So those little mini squats, that's working that knee extension. So that works on straightening the knee out without pointing the foot. So go back to the standing and just stick with that activity until you feel comfortable and you feel like that ankle is staying dorsiflexed while you do these little sit to stands. And that's it. That's all we're gonna do today. I am so grateful that you guys are finding these helpful. It makes the time that I put into them, it makes it all worth it. I appreciate it. I do appreciate the like. It seems like it's something that a lot of people are interested in and are looking to learn more about to help themselves. So keep those likes coming. As usual, go ahead and hit that subscribe button if you haven't subscribed yet, and the notification bell so that you will be the first to know when I post new videos. And again, have fun with this activity. Be patient, give yourself some encouragement. If you are 1% better today than you were yesterday, then you have made progress. So focus on that 1% better versus that 80% better that you want to be. And you will be there before you know it. So again, enjoy this activity and you all have a great night.